So hi, my name is Sammy Saab. I'm doing this podcast on cirrhosis and portal hypertension. When I think of cirrhosis, I think about three buckets. I think about the first bucket being liver cancer. So people with cirrhosis need to be screened for liver cancer with abdominal imaging and blood test AFP every 6 months. The second bucket I think about is portal hypertension, namely esophageal varices, hepatic encephalopathy, ascites, and I like to add also sarcopenia, a late manifestation of portal hypertension. And the third bucket is going to be liver insufficiency, problems with coagulopathy and production of protein and albumin, issues with detoxification and cleaning the blood of toxins. So when we talk about the multidisciplinary approach of cirrhosis, we got to think about two phases: patients early in the cirrhosis and patients late in the cirrhosis stage. So early in cirrhosis, we look for, in a multidisciplinary approach, things we can do to mitigate the natural history. So we're going to work with a clinical nutritionist if someone's got fatty liver disease, to see if they start eating healthy and lose some weight, and they might reduce some of the liver pressures as well. Someone has a history of alcohol use disorder. We want to plug them in and have them see an addiction medicine specialist. In the same token, when patients have very advanced cirrhosis, we're worried about liver complications like sarcopenia. So in this scenario, they also may be seeing a clinical nutritionist, not necessarily to lose weight or eat healthier, but to maintain their muscle mass. In my mind, I feel like hepatologists can deal with most liver complications: liver cancer, ascites, varices, encephalopathy. But when it comes to malnutrition, that's a major problem. So we work closely with the clinical nutritionist to make sure our patients are eating appropriately. They're getting their calories, they're getting their proteins. So, for instance, I told patients when they have advanced cirrhosis, and you know who they are, people who are on the liver transplant list, people who have ascites, that they need to eat 6 meals a day. 3 big meals, breakfast, lunch, and dinner, and 3 snacks. Because invariably when you have cirrhosis, very advanced cirrhosis, people eat like parrots. They eat a couple of bites of a meal and they're full. So I keep the nutrition going. And in other people we work with, and a multidisciplinary approach for cirrhosis, are going to be oncologists if we discover hepatocellular carcinoma or liver cancer. And we work very closely with our interventional radiology colleagues. And patients develop refractory ascites, hepatic hydrothorax, intractable variceal bleeding. We're talking about decompressive techniques like TIPS. Recently, the FDA approved an alpha pump, and that could be also used in select patients to treat refractory ascites. We also work very closely in a multidisciplinary fashion with our radiologists. Needless to say that imaging had become extension of our examinations, to estimating portal hypertension if someone has cirrhosis through transelastography, to looking for hepatic lesions, someone's being screened for liver cancer, to assess for any significant shunting in someone who has refractory hepatic encephalopathy. So working with the team is critical. And the list goes on. With cardiology, because patients with MASLD and MASH are at risk for heart disease, greater risk than the general population. Our nephrology colleagues, because patients with very advanced disease, as a late manifestation of cirrhosis liver failure, they're at risk for hepatorenal syndrome. So work with a nephrologist. Another team we work with very closely are our liver transplant surgeons and hepatobiliary surgeons, individuals who are candidates for transplantation, and also candidates for resection for liver cancer. So the field of hepatology, in the sense of caring for patients with cirrhosis, has evolved significantly. And we're looking at cirrhosis and now different phases. early cirrhosis, and late cirrhosis. And the team you work with in these phases are going to differ slightly, in other cases, quite a bit. So it's a very exciting time to be an hepatologist today, to help hold someone's hand through this journey and get them through the process. So for more information regarding the care of cirrhosis, portal hypertension, please visit the CLDF website. Thank you very much.